So we're going to do quick chambers and vessels of the white heart. So if we were to kind of draw a cross here, we would have 4 chambers. So it would be the area of the right atrium, and these are this is the auricle sticking off of it, the right ventricle, and there would be a muscular wall, the septum, interventricular septum, left ventricle, left atrium is in this region with the auricle sticking off. Okay, now we're going to look at these vessels. So blood enters the heart through the superior vena cava and the inferior vena cava and the coronary sinus. Those 3 vessels bring deoxygenated blood to the right atrium, which then will pass it to the right ventricle, going through the tricuspid or the right atrioventricular valve. The right ventricle is then going to pass it into the pulmonary trunk, which is then going to split into the left pulmonary artery going to the left lung, and the right pulmonary artery going to the right lung. The lung's going to put oxygen into the blood, and then the blood's going to come back to the left atrium via the left pulmonary veins and the right pulmonary veins. Brings it back to the left atrium. Left atrium is going to pass it to the left ventricle through the bicuspid valve. And then the left ventricle is going to pass it into the aorta. Ascending, arch, descending, which will eventually become the thoracic aorta and then hit the diaphragm and then become the abdominal aorta. Branches off of the aorta. Well, the very first 2 branches are the right coronary artery, and then underneath here, the left coronary artery. First 2 branches. Third branch, brachiocephalic trunk. Brachiocephalic trunk is then going to split into the right common carotid and the right subclavian, which goes to the arm. Branches off of the subclavian, thyrocervical trunk, and vertebral artery. On the left side, there's no brachiocephalic trunk. Coming off of the aorta directly is the left common carotid. Coming off of the aorta directly is the left subclavian with thyrocervical and vertebral branches off of the subclavian.